Thank you for braving the rain and coming out and spending the next hour with me. And I do have a special guest who's in the back, and I can't wait so that we can have an honest conversation that kind of just spans how we support pain here at Love.Life. So let's get moving. Breakthroughs in pain management is today. We also have melatonin, vitamin D, and sleep next week. I'm bringing in a neuroscientist named Dr. Tara Zinnemann for the very last one in the series on March 19th. And then we do have a bonus lecture that just happened today, so I might as well share that. And I'll be joined by Gwen Dittmar the very last Wednesday after that, and we're going to be talking about the science of breath work. And I feel like it's a great conclusion to this longevity series, and it was a no-brainer that we wanted to include something that really talks about and speaks to breath work and how important that is for longevity. Disclaimer, this is for informational purposes only. This is not for medical advice. Make sure that anything that you learn here, that you absorb, that you take with you, if you have questions about it, that you're always talking to your provider about it. And I am the lead functional medicine doctor here at Love.Life. So myself and Dr. Anna, the lead integrative doctor, together we make the medical team. We also have our team of experts, a few of which are in-house today, which is really great to see. And I'm a board-certified family doctor. I also trained in functional integrative medicine, and I am a young breast cancer warrior. So breakthroughs in pain management. 76.2 million Americans live with chronic pain. Big number. And this is more than diabetes, more than heart disease, and even more than cancer combined. Huge number. That's 1 in 4 people. 1 in 4 people, even in this room, might be dealing with chronic pain. And remember, chronic pain is anything that lasts, at least in the medical world, anything that lasts longer than 3 months that you might be experiencing. So 1 in 4 people. And doctors will commonly ask patients about pain. And when they ask people about pain and how they describe it, it's strange. I guess that the highlight doesn't work as well, but I'll tell you what we ask. We ask, where is it located? What does the pain feel like? On a scale of 1 to 10, your own perception of pain, where would that land you? When did the pain start? How long have you had it? For some people, it's about certain times of day where they're experiencing more pain than others. And some people have different modalities or different treatments that they've tried to use, so we always want to know what makes it better or worse, whether or not it was caused by some sort of trauma or injury to your body. Does it radiate? And most importantly, on the bottom, might not be able to read that, but it's a very important question. It says, how does the pain impact your daily life? Probably one of the most important questions. And I like this cute little graphic where it shows you all of the different ways that people can describe pain. It's lingering, it's here actually, it's gut-wrenching, it's crushing me, it's deep, it's nauseating, it's sharp, it's tender, it's crampy. And so our own perception of pain, these are just some examples of what people might say when we're talking about it and as they're answering those questions. Here's a breakdown of the different kinds of pain. Acute pain, chronic pain, pain that's actually caused by tissue injury or inflammation, that's the nociceptive pain, and neuropathic pain. And I'll commonly see the chronic pain and neuropathic pain intertwined. Right? Today we're talking about chronic pain. Common providers who care for patients with chronic pain, and who would those be? Hard to read this, but you can see urgent care doctors, primary care doctors, orthopedic surgeons will talk to patients about pain, physical therapists, pain specialists, neurologists, rheumatologists, therapists, psychiatrists, and even in the world of functional integrative medicine, we're seeing patients for chronic pain. And the treatments that are commonly prescribed, sometimes it's patches, oral medications. Sometimes people are choosing over-the-counter options. There's topical applications, injections in different areas of the body, and even nerve blocks in different areas of the body. But what we know is that some of these solutions also create more problems. And so as those solutions create more problems, we're putting Band-Aids on some of these things and also adding more medications and then adding more Band-Aids. So it becomes a complex issue for a lot of people. So there are new ways that were thinking about chronic pain. And when we were at Longevity Fest back in December, Dr. Michelle Weiner, who is an integrative pain doctor who was also double board certified in PM&R, she did a really great lecture on pain, and interestingly enough, at Longevity Lessons, she was probably one of the only lectures on pain, which I also thought was kind of strange because it's such an important topic and it does relate to longevity. So she says pain is not just a physical sensation, it's influenced by biological, psychological, and social factors. So it's not just one reason or one cause, there are many, many influences. And a couple points that were takeaways from her lecture. She mentioned chronic pain comes from a very complex interaction of sensory inputs, emotions, and past experiences. And she mentions that pain is shaped by predictive coding in the brain. So our perceptions and beliefs can amplify or diminish these pain sensations. When I Googled where her practice is, she's in South Florida, and she also does ketamine-assisted therapy. She also does cannabis as well, and a few different dynamic integrative approaches that she has at her clinic. And so I thought this was interesting. Ketamine, a dissociative anesthetic, has been explored for its ability to enhance neuroplasticity and provide long-term pain relief by blocking the NMDA receptor. So there are clinics that have dedicated themselves to different modalities, not the oral pills, not the patches, not the injections, very much from a very different approach when it comes to chronic pain. She also mentioned pain reprocessing therapy. And later on, you're going to see a couple more tools, including Alan's work, where he was the one who invented this pain reprocessing therapy about retraining the brain and how we think about pain. And it says here, a key study that was found that 98% of participants that were involved in this pain reprocessing therapy improved, with 66% becoming nearly pain-free after 1 year. It's pretty good, pretty good. How many of you have heard of pain reprocessing therapy, right? Maybe one, maybe one. But numbers like that, for people who are dealing with chronic pain, that's actually quite influential, and it certainly should be considered. Interestingly enough, Alan's clinic is actually here in Los Angeles. So for those people who are dealing with chronic pain, that may be something interesting for them to explore. The next one, neuroplasticity, refers to the brain's ability to reorganize and form new connections. And can we retrain the brain? There are many clinicians, including few of these that are mentioned today, that say absolutely we can. She is very much an advocate for all of these alternative ways of treating and supporting people, including psychedelics such as ketamine and psilocybin being studied to promote or support neuroplasticity. So we're thinking outside the box these days. It's not so much just the pain medications that people are relying on. People are curious about all of these new ways that they can support treating people. Some other additional tools. I posted this on my Instagram like a week ago, and I asked people to vote. People had no idea that this exists as a topical compound that can be used for pain relief, which I thought was interesting. And I think there were maybe 40 votes. And of the 40 votes, 92% had no idea that this is even a topical preparation that exists. There are other compounded topical preparations that exist similar to this that also include ketamine, just like we talked about, that also include DMSO to help drive that ketamine deeper into the muscles, because we always think of topicals as being just on the surface. And that's not always the case, because certain preparations do get deeper. When I've spoken to a couple compounding pharmacies, interestingly enough, these types of products, including the ones that have ketamine, are used by professional athletes. They're used by people who, from a musculoskeletal standpoint, that are looking for topical relief that isn't systemic, that isn't wrecking their gut, that isn't causing these other problems and side effects. So this does exist, and it's important for people to know that these are preparations that can be used for topical relief.
That's a prescription?
Yes, that is a prescription. Yes, yes. And then we get into another interesting treatment for chronic pain. How many of you have heard of low-dose naltrexone? Yeah. Oh, yeah. Yeah. And so you see from a medication standpoint, low-dose naltrexone helps balance immune responses by releasing endorphins to reduce your chronic pain and inflammation. Interestingly enough, look at all the conditions, and this is just a very short list, by the way, but it's used for a lot of different things. Even in the hormone world, we even use LDN to support fertility, interestingly enough. So, you know, it's not just conditions like multiple sclerosis, rheumatoid, thyroid issues, or inflammation of the gut. Even mast cell activation for people who are dealing with histamine issues, allergies, and chronic pain is certainly on that list. This is just an example of how you see the titration schedule of when people are started on this medication. Sometimes it can make people sleepy, so they'll take LDN at night. Dosing-wise, it's usually working up to the 4.5 milligram dose, and it mentions here benefits typically within about 6 weeks. Now, there's no perfect magic bullet. Nothing works for every single person out there. But it's just nice to know that these options exist, because maybe you had no idea that these were even possible. So the purpose of the education here is to make sure you know about these outside-the-box things.
Does that have to be pill form only?
LDN, that's a good question. It is in pill form. Only. Correct. Yes. Yes. That one is in pill form only. And so I pulled together some more information because I'm a bookworm. I like reading. And here's a couple examples of some books that really delve into the pain, okay? John Sarno wrote this book, The Mind-Body Prescription. It's a little bit of an older book. And one big quote he mentions, the unconscious is terrified by the rage and reacts to avoid it by keeping it repressed and employing physical symptoms to aid in that repression. So from a repression standpoint, are we holding a lot of our disease in our tissues that is also based on psychological issues and trauma and life in general? It just begs the question. We're just asking. This book by Alan Gordon, who's the one that I mentioned, who started the pain reprocessing therapy, this is probably one of the first books that I read dealing with chronic pain. And my husband, Charlie, is the one who said, hey, I want you to read this book and tell me what it's all about. Because healing with chronic pain, especially musculoskeletal, I mean, my husband was a professional skateboarder back in the day, and he still skateboards, and of course he's trying to maintain his body and his life. He surfs frequently. So he himself is always looking for these outside of the box tools. And here, you know, a couple points that were really mentioned in there. He talks about neuroplastic pain, how chronic pain can really result from the brain's pathways just being stuck. And this is what causes the persistent pain, even if the physical injury is no longer there. He does emphasize the mind-body connection. He talks very much so about this pain reprocessing therapy. And at his clinic, he also offers this as well, which is located here in Los Angeles. And he talks about how important it is that people understand their pain. He also mentions how there are studies, including a trial at the University of Colorado, that showed that pain reprocessing therapy can significantly reduce pain. And this was with lasting relief for many of the participants that were involved in that study. I liked his quote here. Most people experience pain not because of the structural issues in their bodies, but due to learned neural pathways in the brain. Let's say that again. It's not about the structural issues. It's about the way that our brain is processing the information from what it's experiencing. This means that the brain is misinterpreting safe signals from the body as dangerous, and this is what leads to chronic pain. When I think about some of these statements, it takes time to sink in. You may need to think about it more, and if you're interested, when you read some of their books, there's a lot of highlighting, there's a lot of ear folding on my pages, because you really need to take time to settle in as you're learning a lot about this information. Alan says, after years of treating my body as the enemy, I began seeing it as an ally. Embracing positive sensations helps your brain feel safe. So for a lot of people who are dealing with chronic pain, their brain doesn't feel safe, their body doesn't feel safe. And creating that safety in whichever way, shape, or form, and using all of the different tools and treatments that we have is really the most important thing. I have a funny story about this book. Well, it's not so funny, but it's a story. I picked this up, The Body Keeps the Score, and I hated it. I had a really hard time with it. I think as somebody who's been through childhood trauma, I wasn't prepared to read a book like this that talks about the body keeping score. And when I first read it, I literally stopped within the first couple of chapters and I put it down and I said, now's not the time for me to read this, because it was triggering and it was also creating more problems. But I mention it because it's such an important book that when you are ready and when you feel safe to be able to read a book like this, or maybe this is something that you pick up in bits and pieces, it's a good read. It's a hard read, but it's an important read. And according to Gabor Mate, he says, the body keeps a score. Our physical pain is often a reflection of emotional, psychological, or unresolved trauma that has not been processed. That was probably me at the time of reading the book, that I still had more work to do, and that's why it was also triggering to read the book. So if you don't know how to say no, your body will say it for you through physical illness. We see this all the time at Love.Life. Because one example you'll have is people come to you for physical ailments, but as you learn their story and as you talk to them, and we spend that first solid hour just listening and hearing their story, there is so much more than just those top 2 or 3 goals that they came in to see me with, because you're learning about their journey, their life history, you're learning about all of the different conditions they've had. And when you finally have time to spend with your doctor, you're spending time talking about those things, you realize that your story is far more robust than the 15-minute doctor appointment for my leg pain. And that's an important thing to acknowledge. We see emotional trauma, we see that represent itself as inflammation in the body, as hormones not working well, as chronic disease happening. So there are things that we're seeing from a physical standpoint that really get rooted back to some of the emotional issues, and that's something that he mentions. Nadine Burke-Harris, she was the first Surgeon General in California, and I first heard about this book. It's on the bookshelf in the Love.Life library in medical, in case you're interested to flip through. I first heard about this book after watching her TED Talk, in which she talked about how trauma has an effect on our bodies. And I think that TED Talk has probably been viewed 7 million times. When I watched the TED Talk, I was like, ooh, she knows exactly what she's talking about. Then I started Googling her, searching her, and I found this book called The Deepest Well. In it, she talks a lot about ACEs, adverse childhood experiences. And we know that this refers to childhood trauma, it refers to abuse, neglect, and household dysfunction. And she talks about how these experiences can impact your emotional and physical health for your lifetime, not just at the moment that they're happening. Connection between ACE scores and chronic pain. Research shows that individuals who have higher ACE scores, they're more likely to experience chronic pain and other long-term health issues in adulthood. Then she also mentions, too, that this accumulation creates a vulnerability to chronic health conditions like pain as the body's stress response system becomes overtaxed over time. Let's talk about that. The body's stress response system becomes overtaxed over time. So when we talk about pain with patients, not only does it elicit an emotion, there is also a nervous system component to it that we acknowledge. And for a lot of patients who are dealing with chronic pain or who have had pain, their nervous systems are upregulated. That safety in their body doesn't exist. And that's also part of the root cause problem. And this is why we have experts at Love.Life who have dedicated their professions to really understanding that side of things, the emotional side of pain. Another interesting technique, the Alexander technique, that can literally help you unwind. And this one focuses more on improving your posture, improving movement, and improving your body alignment. But I put the QR code here because for some people, this is about the day-to-day, low-grade, insidious, chronic pain that they continue to have. And you'd be surprised that certain exercises and the way that we carry our bodies from a posture standpoint play a crucial role into chronic pain. So Rachel Zoffness, she is a PhD physician. She wrote the book, The Pain Management Workbook. And this QR code is to a podcast that she did with Ezra Klein a very interesting one for those of you that are interested in learning more about chronic pain. Here you can see something that she says that, again, just reinforces everything that we just learned. While we tend to think of chronic pain as a purely biomechanical or bodily phenomenon, neuroscience now more widely understands that it is a complex biopsychosocial phenomenon. It's also constructed by the brain, as evidenced by phantom limb pain. Pain is always 100% real, but to effectively treat it, it's often not enough to target the body part that experiences it. We also need to target the brain that can learn to become less sensitive to pain through habituation. Right? Not about the area where the pain exists, but about its connection to the brain and how your body perceives it. Somatic therapy for pain relief, which is really where we're going to take the conversation today. So somatic therapy is this approach that really focuses on the mind-body connection to treating chronic pain. And there are different techniques. There are breathing exercises and movements and awareness practices that help us release stored tension and address the root cause of pain. I'm excited because we've got our in-house expert, Karen, here today, and we're going to have a little conversation. We get to ask open questions to Karen as well. She's one of our experts at Love.Life, so when people see myself or Dr. Anna, we will always, or sometimes, not always, we always will refer them to one of our experts, and some of the experts, depending on the patient's situation or case, would really lend itself to the work of each of them. So whether it's seeing our Reiki and energy healer, Kristen, or seeing our acupuncturist and Chinese medicine practitioner, Natalie, or even seeing Karen, it's an opportunity for people to really delve in to some of these other aspects. So how somatic therapy helps with chronic pain: reduces tension, stress, encourages healthy movement patterns, teaches emotional regulation techniques, and it can also uncover mental and emotional root causes for pain. What I find really interesting about the work that Karen does is I sent over a patient, and you'd be surprised the depth of the conversations that a practitioner who specializes this can really get into when it comes to learning about where a source of pain is. Sometimes it's not just me. Sometimes they also need somebody else who is a professional in this to really help them understand it. And it's also cool at Love.Life because I was very fortunate enough to witness this. I got to sit in on a visit where Karen was seeing one of our mutual patients, and the patient wanted me to be present so that I could be there to listen in on the conversation to see how things went, to understand some of the techniques that she was given. Grateful for that experience because you don't really get that anywhere else, where your doctor can sit in with an expert to experience that. So I was able to witness her work, and the patient was experiencing pain, interestingly enough. And by the end of the session, she was given the right tools, and she had that experience to feel really good walking out the door to say, okay, now I understand the source of pain, and I have the right tools to be able to help my body relieve from it. So thank you for the work that you do, and it was really great to be there and witness that. Some more tools that people look into for chronic pain. The Gupta program by Ashok Gupta. This one was highly recommended from my previous practice. So a lot of people were using the Gupta program for lots of different chronic diseases. It does not just refer to chronic pain and fibromyalgia. This was also for people who are recovering from long COVID. This was also for people who were dealing with cancer. It was people who were dealing with immune conditions and disease states. And the Gupta program also offers, I think, 1 month free, and usually it's about 10 to 15 minutes per day. So I'm putting these resources here so that you have an opportunity to also explore any of them, because nothing is going to resonate with everybody, but you never know. With enough resources out there, a few things are going to resonate with some people. It wouldn't be right to not also mention some examples of some helpful compounds that we use from a functional medicine side and an integrative medicine side when it comes to people who are dealing with chronic pain. So sometimes I do like the joint support blends for musculoskeletal type pain. So think about glucosamine and MSM and chondroitin and collagen and different types there. PEA, curcumin, omegas, specialized pro-resolving mediators. This is also highly distilled fish oil that targets prostaglandins, which are chemicals that your body releases whenever you're experiencing pain and inflammation. I mentioned the topical compounds and some of those preparations, like the sticky, the screenshot that you saw there, or even the ones that also have the ketamine and the DMSO to help deliver it. So there are topical compounds that your providers can prescribe to help support that. There's also different ways magnesium gets into the body. So I always think of magnesium as being something that is probably one of the most relaxing minerals that we have available to us. People use cups of Epsom salt in baths. We use magnesium in lotion form. People spray it, magnesium, on their body, either on the legs, the calves, or even the feet. And then there's so many oral different kinds of magnesium out there. Some that are targeted towards drawing water into the stool to help you with constipation, some that help your nervous system, and some that target the brain. So that's also a really powerful one. The different herbal preparations that exist, like even inflammatome is one example of that, usually have things like boswellia. They also have ginger. You'll also see curcumin in those preparations, and a few other herbs. And I mentioned ginger because people forget that from an anti-inflammatory standpoint, you always hear of ginger tea being helpful for nausea, where you literally just slice and cut up the ginger and boil it and put some lemon and drink it as a tea. But there are studies that show ginger in capsule form for people who are really struggling with even PMS symptoms and headaches. Interestingly enough, it's gone head-to-head with NSAIDs like ibuprofen and Advil and all those things. And ginger capsule form versus ibuprofen and Advil, which also is going to create more problems in the gut, ginger wins. So people don't know that ginger in capsule form is also a possibility as something that can help with inflammation instead of taking naproxen and any of the others. So just another example. And I wish that this showed up better, but you can see that the tools that can support pain at Love.Life. When I look at the list of all of the things that we offer at Love.Life that help to support people with chronic pain, it's everywhere. It's in every corner of what we do at Love.Life. Whether you're seeing the physicians or seeing any one of our experts on our team, or engaging in somatic therapy with experts like Karen, or utilizing traditional Chinese medicine with Natalie, acupuncture with Kristen and Natalie, Reiki and energy healing with Kristen, our meditation practice. We have access to hundreds of classes that happen every month. Breathwork, stretching, dance, movement, yoga, physical therapy, and personal training, or even the combination of those two with Danelle and one of our trainers. Whether people are utilizing massage to help relieve the actual muscle tension, the hot and cold therapy and red light therapy, and then of course the pulsed electromagnetic frequency that we have over there that is really electromagnetic stimulation to help support people who are dealing with chronic pain and musculoskeletal issues. So there are so many that we have available, and HBOT is also on that list. And this is right inside this building that we have all of this, which when I think about all of the tools and the books and the podcasts and all of that information, right inside Love.Life, we have so much support for people who are dealing with chronic pain. The last thing I'd tell you is, before we break for just a few minutes so that we can get Karen up here to answer some questions and talk more from a somatic therapy standpoint, is this is my email. And if you don't mind, I would love for you to email me and tell me how you feel about what you learn throughout longevity lessons. We want to continue improving the program, and as we continue to bring in all of our other clinicians, Dr. Anna's series next is mainly on fitness and recovery, we're going to keep reiterating these. I have my own ideas of what I would love to share with you all, including walking through patient cases and talking through lab results so people can understand what the lab data is, and maybe even talking through specialty testing and showing you what protocols look like, but that's just my ideas. I would love to hear from you. This is an opportunity for you all to tell me what you're looking to hear. So I would encourage you to send me an email with any of your thoughts and feedback so that I can take that with me and run with it. And that way in the fall, when I do another Longevity Lessons 2.0, then we can at least talk about more topics and bring in more experts. We have melatonin, vitamin D, and sleep, and there are a few goodies that we'll be giving at that one. And then March 19th, I'm bringing in Dr. Tara Zinnemann, and She is a neuroscientist. We're going to talk about the gut-brain connection. So I'm excited to hear from Dr. Tara on that one. And then the bonus lecture that we just ironed out the details, that will be the science of breath. So we'll be having that one the following week after the 19th. So I believe that'll be, 25th, 26th? 26th, the science of breath. This is where you can find me, and also you can find Love.Life on Instagram. And then we're going to break so that we can set up the chairs and we can get Karen up here and answer some questions. I would love, Karen, first of all, please share a little bit about yourself.
Okay.
Give yourself your own introduction.
Sure.
Yeah.
Yes, so my name's Karen Robbins, and I'm a licensed clinical social worker in addition to being a somatic therapist. So all of this information about biopsychosocial approach to everything, that was social work school. And I had a particular interest at the time in medical social work. So I worked in hospitals at the time with people with HIV and AIDS in the 90s, a while ago. And I didn't know what somatic therapy was. And so eventually I did discover that. And I'm like, this is what I've always wanted. I've always felt like there's something with the body, the way emotions are processed and held, and the person in their community. So this kind of intersection was a path I was on that I didn't quite realize until I started learning about this. So I started somatic therapy in 2009, my first training. So I've been doing that ever since. Yeah, love it.
So if you were to put it in your own words, I'd love to hear how, how you define it, please, for us.
Yeah, the simplest way to talk about it is that we're looking through the nervous system. And so that's the system we're tracking. And so we're talking about the stress response here, but we're also talking about within the nervous system a lot of other things. So we're talking about sensations. That slide with all the pain words, those are all sensation words that we would look at. We're looking at emotions. We're looking at images or impressions, the way we sense our world. We're looking at behaviors. So like what behaviors are really the only observable thing. And then we're looking at meaning. And so not just mental, like I learned this and I apply it to me, but something coming from inside the body that's like, oh, I understand myself in a different way. It's like an emergence of a meaning that comes from the body. So those are all related to the nervous system, in addition to the things that we're used to: fight, flight, freeze, and appease or fawn.
Yeah.
Yeah.
So when I recommend, or when Dr. Anna recommends a patient to see you, sometimes we think that there is a certain reason why they want to see you. But in the work that you do, are you finding that there are many more reasons and so much more underneath the hood that needs to be processed?
Yes, I mean, often. And so what I'd like to do is sort of meet the person, and then everyone has a different what they want. So it might be something for like, I just want to have a consultation and learn about what you're talking about, or we might in our conversation find there's something else going on, and it didn't occur to me that I could go see a mental health professional because I'm having physical symptoms. It's not on the radar. I don't feel anxious or depressed. I know I have grief, but I don't feel those other things. Meanwhile, there's a very profound trauma picture, for example. So, it's a little detective work sometimes. Yeah.
To get down to the root of things from an emotional standpoint or a physical standpoint, does it take a lot of time in the work that you do? Is that something that you can help figure this out rather quickly, or does it take multiple sessions to really unpack it all?
It depends. Yeah, so sometimes people come, if we're thinking about trauma, which is kind of the traditional thing that we hear about connected to somatic therapy, sometimes people know there's an event that occurred. So I had a car accident and now I have this pain, and so they're aware of that event. They might come in relating to an event and their pain and something like that. The ACEs situation, which are the adverse childhood experiences that is another category which comes from our childhood, our relational world. They may be mixed with event-based traumas, but also it might be a series of misattunements. It might be intergenerational, that didn't even happen to us, but that occurred in our lineage and that we have the nervous system or cell structure for. So it's very rich. So yeah, it depends.
It depends.
And then it kind of is like, okay, what are we going to work with given that? And depending kind of what we find and what does the person want. So yeah.
Yeah. Are there certain tools that you think that everybody could benefit from just to help support us on a day-to-day basis?
Nature. Yeah. My favorite thing, get outside into nature. And when you do that, don't just like, okay, I went outside. Oh, maybe I got my sunlight. I've heard of that. But pause for a minute. So pausing would maybe even be number one. And then pausing in nature. So we can think about it as like, where can we savor our experience a little longer? So it's like, okay, I'm out here. Oh, I hear the rain. So my auditory sense is available to me. Okay, let me just see if I can just pause and breathe and take that in for a moment. So we're matching up the senses with the natural world. It's one of my favorites. So pausing, number one.
Yeah. Do you feel like chronic pain is something that you commonly see?
Yes and no. It's one of those things that may not come to my attention because it's in that category of maybe people don't think to bring it to their mental health professional. I stumble upon it, I would say, more often than that's a presenting issue. Not so much here, that's a presenting issue. And because the team understands, oh, okay, we can perhaps see another angle.
And what's it like working with a team of experts? I mean, you were in private practice before. And so this is a very different environment, right? Like to work with, 10 other experts. What's that been like?
It's my favorite. Those are my origins. My origins were on a multidisciplinary team in mental health settings and then hospital settings. So that is my favorite way of working, even in my private practice. I love it when I get to collaborate with either a traditional talk therapist or other body workers, other disciplines. So
great.
Yeah, it's just so enriching and exciting to hear the different opinions and perspectives and everyone's view and the respect of each other's, gifts, really.
Yeah. Well, thank you.
You're welcome.
Thank you. I'd love to open it up to all of you to ask questions if you have any.